Okay, so now I'm in the moment. I'm noticing that I'm being triggered by this aggressive nurse or this doctor who's acting disrespectfully towards a patient. And now what do I do with that? I notice that I'm being triggered and I'm forcing air in so the oxygen can blunt my anxiety experience. I'm refusing the bait. I'm not going to react to this. I want to act respectfully and effectively to it. So what do? Perhaps nurse X talking to midwife X, barking at her. Midwife X tries to model respectful behavior and says, I can see this is very upsetting and I'm doing the best I can in a calm tone of voice. While that sometimes is effective, it can backfire. It can come across as patronizing or condescending. It's oftentimes too subtle if somebody is acting angrily. If it's not effective, or if one wants to look at other options, Nurse X instead should be using a practical tone of voice, not coming in too soft and not using her weird conflict resolution voice, obviously not escalating and sounding too aggressive. I can see this is upsetting, but instead trying to land with a nice practical tone. Clearly, something isn't working here. Let's get through this. Talk about the future state. Talk about your commitment to getting this positively resolved, and then just get through it. This is not the time now to get too deep into that difficult conversation when we have a crisis on our hands. Let's look at the other situation of Dr. Y, who's perhaps working with a woman very assertively or aggressively, and midwife Y perceives that to be inappropriate, disrespectful. Again, rather than reacting into fight mode, she's going to notice that she's being triggered, force air in, refuse the bait, and rather than reacting in fight mode and coming across too aggressively, she should be matching more or less what's happening in the first scenario. Strive for a practical tone of voice. One strategy that may be effective is to make your point by involving the patient, if she's able to become engaged, is to turn and say, how are you? Are you comfortable? Are you okay? Is the way we're touching you okay? There may be an option there to try and leverage a little bit of a hint to the physician. However, that's oftentimes too subtle as well. It may take the form of just directly describing the concern and then focusing on getting the task done. Again, in a critical moment like that, that's not the time to get into the full difficult conversation. It may sound something like, I'm concerned about how we're working with this patient. Could we be a bit more gentle? Something that talks a little bit about a solution to the problem and focuses on getting through it. It's awkward, it is uncomfortable, and it's setting up the next video clip where we're going to talk about it afterwards in a follow-up discussion.